We're speaking with Dr. Tony Dodek, Chief Medical Officer for AllWays Health Partners. Let's shift gears a little bit and talk about healthcare and healthcare access in the community. Can you talk about some of the barriers to healthcare that Massachusetts families can face?
Sure. For many families, the barriers are financial.
Yep.
And some families, particularly in certain pockets in the state, lack access to basic needs such as stable housing, nutrition, and access to care. And, of course, that all contributes to poor health outcomes.
Right.
Another barrier is the shortage of behavioral health providers in Massachusetts, which limits access to those services. And that's an important component of healthcare.
Are there ways that those barriers are being addressed and ways where that Massachusetts in particular is trying to improve upon those?
I can speak specifically about our organization, AllWays Health Partners. We're working with an accountable care organization in the Lawrence area, the Merrimack Valley ACO, to improve access for our Medicaid patients. And we're combining the use of data, population management, and case management to identify members who may need additional support and then help them coordinate their care. We also have a specialized program which we call Your Care Circle, and that's a multidisciplinary team that consists of nurses, social workers, community health workers, pharmacists, nutritionists, and recovery coaches if substance use is a problem. And that team coordinates care to address both the social determinants and the medical issues. And we also provide support for nutrition, transportation, and even communication needs if need be.
Dr. Tony Dodek is Chief Medical Officer for AllWays Health Partners. We're talking about healthcare and health-related issues. One of the terms you hear in healthcare is community partner, and I wondered if you could just tell us what that means and what role community partners play in taking on some of these health issues.
Community partners is kind of a catch-all term for agencies that help with those social determinants of health. So, for example, they could be behavioral health providers, they could be social workers, or an agency that provides case managers to help manage a complex condition for a particular patient or their family. They're essential to addressing and improving the barriers that people face. They help with coordination of care and addressing those social health challenges that I just listed.